Good evening, ladies and gentlemen. Thank you very much for your commitment to freedom, liberty, and the constitutions of the United States and the state of Kansas, reflected by your participation here tonight in this Freedom's Big Three Symposium. I'm Kansas State Representative John Rubin. I regret that prior commitments have prevented me from joining you tonight in person, but believe me, I am with you in spirit tonight. I am with you out of our mutual concern and commitment to the best interests of Kansas taxpayers and a better future for our children and grandchildren. I believe that I share with you an overriding concern and fundamental opposition to the implementation in Kansas of the Patient Protection and Affordable Care Act, which I'm going to refer to for the rest of our discussion together here as Obamacare. As you all know, our federal government is one of limited, specifically enumerated powers under the Constitution. And the 10th Amendment to the United States Constitution says that any power or authority not specifically granted to the federal government under the Constitution, nor prohibited to the states, are reserved to the states or the people thereof. I submit to you that, as in so many other areas, the federal government has overstepped its bounds by attempting to legislate in an area that is reserved exclusively for legislation and decision by state governments and the people of the individual states. I've sworn to uphold the 10th Amendment and all of the United States Constitution and the Constitution of the state of Kansas, and that is why I'm so concerned with the inroads being made on the 10th Amendment by this legislation. Make no mistake, our opposition to Obamacare is nothing less than a referendum on the continued viability in Kansas of the 10th Amendment. I've become increasingly concerned, as you have, I believe, in recent months, that we in Kansas, despite our official position that Obamacare is unconstitutional and unenforceable in our state, have proceeded with implementing parts of it. The state of Kansas has entered into a contract with a company called Accenture for development of an information technology system for Medicaid in the state of Kansas. The funding for this contract, 90% of the funding for this contract has been provided by the federal government, and the state is paying 10% of it. I have thoroughly reviewed that contract, the accompanying statement of work and bid documents with regard to that contract. And in no less than at least 11 different areas, this contract requires compliance with or compatibility of Medicaid information technology information with requirements in Obamacare. In other words, the contract specifies that the information technology system being established for Medicaid in Kansas be Obamacare compliant. We're paying extra money, extra federal and state taxpayer dollars, to implement those provisions of the contract. We should not be spending those funds to implement any portion of Obamacare at the same time that we are arguing now before the United States Supreme Court that the entire law is unconstitutional and unenforceable in Kansas. Quite apart from Obamacare requirements, we also believe that the KEES contract with Accenture should be terminated because of questionable and most likely illegal conduct on federal government contracts committed by Accenture in the past. Specifically on September 12th of this year, only 2 weeks after we inked our KEES contract with Accenture, Accenture agreed to pay the federal government $63.7 million to settle allegations that it received millions of dollars in kickbacks from tech companies in exchange for recommending that federal government agencies purchase these companies' products. Accenture's actions, which included, according to the lawsuit, fraudulently inflating prices and rigging bids, caused false claims to be submitted under numerous information technology contracts with U.S. government agencies. And that's according to the Justice Department. And that litigation was started by the Bush Justice Department and concluded by the Obama Justice Department. Why is the state of Kansas doing business with such an apparently disreputable and dishonest contractor? It is time that we in Kansas join these other states in demanding that the Obama administration stop governing against the will of the American people. Now it's my pleasure to introduce to you your next speaker. Steve Shute is a co-founder of the Union of Patriots, and is well-versed in and an eloquent spokesman for personal freedom and liberty under the United States Constitution and the Constitution of the state of Kansas in the areas that we're talking about here tonight at this symposium. So without further ado, let me introduce you to Steve Shute. Thank you very much, folks.
Isn't Judge Rubin just an awesome, awesome representative and official? We're going to go into this a little bit later on, but Judge Rubin a couple of weeks ago took a delegation of legislators to Topeka to address this subject directly with the governor, the lieutenant governor, and their staffs. And that takes some courage. But first of all, let's take a look at something here. Now, I think we can all agree with this statement, right? Obamacare is the most destructive piece of legislation ever passed by a sitting Congress. I would even say it's worse than the Alien and Sedition Acts and the Insurrection Acts in the late 1800s. This thing is absolutely a freedom destroyer. And we're going to go into a couple of examples very quickly of exactly how it's a freedom destroyer. Well, you guys have seen this before, haven't you? This was actually put out, and when they did this, when Secretary Bryan Congressman Bryan brought this out, his office brought this out, the Obama administration and all the minions in HHS who were trying to force this bill on us said, well, this is just scaremongering, this is fear-mongering, and nothing like this will ever happen. Well, last time I checked, about 3/4 of the agencies that are currently listed on that document have been created in the last 18 months. Now, I don't know about you, but that tells me they were pretty close to the mark. Just how bad is Obamacare? Well, first of all, it's over 2,400 pages of legislation. We know about that because Nancy Pelosi said, well, you know, you've got to pass it to find out what's in it. Well, what people didn't say is that what was in it is another 10,000 pages of regulations, and it's growing every day. In something like 700 different areas of the Obamacare law, there is the phrase, the Secretary shall determine the disposition of this section. Who is the Secretary? The Secretary is HHS Secretary and former Kansas Governor Kathleen Sebelius. Oh, by the way, I do have some notes here. I apologize. I did not bring my teleprompters. But anyway, how bad is Obamacare? It also fundamentally changes the delivery of health care. Now, let that sink in here. Because most people think, oh, the Patient Protection and Affordable Care Act, it's supposed to handle insurance, it's supposed to make things cheaper, it's supposed to make things more available. Well, in truth, the way that the Obamacare law is structured, it will make things less accessible because it'll be more expensive, and it actually does increase the cost curve by an order of magnitude over what it currently is today. But it does do something about delivery. It basically tells you that we're going to control what you get in terms of your health care. And it does that in all sorts of areas of this law. It does not address price except to increase the cost of care. And it destroys personal freedom, privacy, and choice. Ever heard of HIPAA? Anybody know what HIPAA is? The Health Insurance Portability and Accountability Act. Basically what it was supposed to do, it was supposed to lock down your medical records and make it impossible or virtually impossible for an individual to be able to get your information unless you gave them explicit permission to do so. And even then, you had to have some sort of specific authorization in writing to do that. Okay? And it will decimate state budgets. That is the biggest problem with Obamacare. And I'm going to get into that in a little bit as well. Okay. You've probably seen these particular quotes. Kansas Governor Sam Brownback said in February of 2011, if fully enacted, the Obama health care plan would devastate the Kansas budget. He's right, by the way. With unaffordable mandates threatening every other priority in government. And you probably have seen this as well. How many of you are members of the Republican Party? I don't know if I'd be clapping too much, but in this case, they got it right. And I was happy to have helped to co-author this resolution C, but therefore it is resolved, the Kansas Republican Party in the strongest possible terms rejects all, that's the key word there, all parts of the ACA is unconstitutional. And in contravention of the rights of the people and the 10th Amendment affirms sovereignty of the state of Kansas, and that any and all efforts thereof by any government agency, entity, or elected representative in the state of Kansas to study, develop, or implement an ACA-compliant exchange or any component part. That means anything that could have to do with an exchange in the future be immediately halted. How many of you heard this? Didn't Kansas stop implementing Obamacare by returning that $31.5 million? An early innovator grant that Sam Brownback to return the Tuesday before the state convention meeting that passed that Resolution C. No, it did not. And that is the dirty secret that we're going to unmask for you this evening. The Kansas Eligibility Enforcement System. It is now the second iteration of a system that was formerly known as KMED. Okay? KMED was actually created and designed under the auspices of the Early Innovator Grant, that $31.5 million that Mr. Brownback so magnanimously returned. Unfortunately, the KEES system, because it requires certain funding that only is available if you implement Obamacare, I have the documents right here to prove it. And by the way, we do have over 10,000 pages of documents at our offices over in Shawnee, but I didn't want to bring a forklift. It would have been a little cumbersome, so what I'm doing is I took a few pieces, and very critical pieces, to read to you, and I'm just going to read basic sections to you. But basically, the KEES system is a Trojan horse. There's my Trojan horse. I wanted to get a real Trojan horse, but that was the best I could do. Designed to implement Obamacare in Kansas under the guise of stopping Medicaid fraud. Now, this is interesting, an interesting little diagram. On the left, you'll see the Obamacare architecture. There are 24 major components of Obamacare. 24 in 2,400 pages, about 100 pages a section. Now, on the left-hand side, under the third from the top, you'll see something called the individual mandate. We'll get back to that in a couple of minutes. Below that, you have premium and cost sharing and a web-based insurance coverage scheme. Below that, you have something called medical homes. Go to the very bottom of the first column. Do you know that the Brownback administration is submitting bids right now to implement medical homes? That is part of the ACA. So it's not just the KEES system we're talking about here, but the medical homes section, that medical homes division that they're going to be designing and building is going to be meant to be created to interface with the KEES system. You'll see some other things there. Lower right-hand corner, Title 9, the ACA taxes and assessments. You'll find out more about that as well in a couple of minutes. We have 20 or more new taxes. They can be levied at the discretion of the Secretary, by the way, like most things in this bill. On the right-hand side, you will see the KEES architecture. On the upper right-hand corner, you'll see the exchange. Yes, that is the only part of the KEES system that is not being implemented. Phases 1 and 2 are being implemented. Phase 3 is being held off until and unless the Supreme Court rules on the constitutionality of Obamacare. That is at the discretion and at the instruction of the governor. Now, how are these two related? Let me start. Right there, 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 and right there, right there, right there, right there, right there, and a couple of more. Right there. That's just a few of them. That's some of the ones that we've actually identified. But I could go on and on and on, because here's the deal. Fact. Nowhere in the KEES Accenture contract is the system not compliant with Obamacare. Nowhere. Nowhere does it say this is not going to be implemented subject to the rules of the Affordable Care Act. And the reason why is because there is something called CMS. Ever heard of CMS? These are funding rules for different types of Medicaid funding. The Obamacare law gave the Secretary of Health and Human Services the discretion to modify Medicaid rules, as well as funding rules. So that's exactly what happened. They created a 90-10 matching funding scheme that basically required you to go and comply with Obamacare in order to be able to satisfy the requirement of getting that money. It's a 90-10 matching grant. Where did I hear that from? Oh yeah, that's the same money that Governor Brownback took in order to be able to implement this $138 million system. But that's not all. This is really scary. I've heard of multi-state software as a service. Now, I work in IT. I work in healthcare information technology, and that's why I'm so passionate about this particular subject. But when I talk about software as a service, ever heard of the Microsoft Cloud? The cloud, everything's on the cloud. It's all puffy and cute out there. Well, the problem with the cloud is that it also means that that information is easily accessible and distributable as well. Right? Say goodbye to HIPAA. Your security, your safety of your information is gone when this gets implemented. But it also means that we're not only implementing Obamacare in Kansas. You see, there's a section in here in the advanced planning document, which I will read to you right now. This won't take about a couple of seconds. It says, the Kansas will provide leadership by assisting other states, either through technology and or knowledge transfer. Kansas will share work products developed during this project with other states. These products will be disseminated to states, federal partners as appropriate. The Kansas solution will also be made available to other states. The scalability of the solution will enable the fixed design and implementation costs to be allocated across multiple states, thereby decreasing states' compliance costs. You know where this comes from? The early innovator grant language. Nothing has changed, ladies and gentlemen. We're still dealing with the same wording, the same contract language, the same. And by the way, this is what's called an advanced planning document. This is what we must submit to the Secretary of Health and Human Services to receive the funding for the project. Yes, that is correct. Let me see here. Other states will have the option to use the Kansas solution to help them meet prescribed federal guidelines and deadlines. Kansas is also planning to offer this solution as a software as a service model, thereby reducing implementation costs for other states and increasing implementation speed for other states. In other words, what we build, Illinois could use, Iowa could use, Arkansas could use. Oh, by the way, Andy Allison, who helped to birth this monstrosity, is now in Arkansas and heading up their Medicaid division. You wonder what he's going to be doing in Arkansas. Probably the same thing, you see, because they're trying to do this over several states so that we can't peg him down. But that doesn't mean that we have to do it here in Kansas, and we've got to stop this. Why is the cost of KEES without exchanges 4 times higher than the original estimate of the K-Med system with exchanges included? Ever asked that question of yourselves? Originally it was $30 to $40 million. Now it's $138 million. So why would a system with decreased levels of functionality, i.e. no exchanges, quadruple in price? Will the Supreme Court save us? How many people think that the Supreme Court will strike down Obamacare and save us all from that monstrosity? How about this one for you? If the Supreme Court strikes down the individual mandate but leaves the rest of the Obamacare law intact, we will be stuck with a single-payer system in the next 2 years. Believe it or not. Because when you get rid of the infrastructure to fund something, but you leave everything there to be funded, it collapses under its own weight, and private insurance goes away. And there's a massive increase in Medicaid funding. It's going to fund a massive expansion of Medicaid in the Obamacare law to handle just this contingency. The only sure way we can stop or significantly slow down Obamacare from coming to Kansas is to stop the KEES system from being implemented. Period. Rescind the contracts, get rid of the corruption. Accenture has already got all sorts of issues with regard to malfeasance and ethical lapses. What can we do to stop it? You need to get the facts for yourself. Don't believe a word I say. Go and read the facts. We're going to have them up on the Union of Patriots website within the next couple of days. Or you can come to our office and wade through the 10,000 pages. I think that's fine. Every legislator that we've talked to about this at our offices has come away convinced that we are complying with Obamacare. Every single one. I haven't run across a single legislator after seeing the evidence that we have in our possession has come away saying that we are not correct. Call the governor, call your state representative and senator. Make this a priority in the next legislative session. If you don't do it, they will not address this. And fill out our Freedom's Big 3 scorecard and be vigilant, active, and brave. I love that phrase. It comes from one of my favorite patriots, Patrick Henry, in his Give Me Liberty or Give Me Death address. And we must be vigilant, we must be active, we must be brave, because these people are going all out to enslave us right now. And a lot of them don't even realize they're doing it. But we are on the cusp of this, and we need to work together to stop this. There is not a lot of time left.